happens, the Subject Expert Committee or SEC has recommended regular market authorization to Covishield and Covaxin. This effectively means that they could be available in clinics and hospitals registered, it seems, with Covin, and also chemists associated with clinics or hospitals can sell these, provided they are registered also with Covin. Let's try and break this up for us. Vishnu Shom also joining us with this breaking story right now. Vishnu, explain to us what this is going to mean. We're obviously getting just partial information at this point, but this really could be
Actually,
huge.
Ankita, it's not partial information at this stage. At this juncture, I would suggest that this is very much on the way to Covishield and Covaxin being available as boosters across the country. Now, the Subject Expert Committee of the government, it's an arm of the Health Ministry, has recommended the regular market authorization to Covishield and Covaxin with conditions. I'll explain all of this. Now, these vaccines, according to sources, will be available at clinics and hospitals which are registered with Covin, and at the time of administration of the injection or the vaccine by a hospital or clinic, this has to be all entered into the Covin system. Now, several weeks back, the Serum Institute of India had approached the government saying that, look, we have administered more than 1 billion doses around the world of Covishield, and the vaccine is well tolerated, it is extremely safe, and therefore, while emergency use authorization was given for the use of Covishield, why don't you allow full market authorization so that it can be available at pharmacies? As you know, neither Covishield or Covaxin are available in pharmacies. They are available in hospitals. They're procured by the government. The governments give it to hospitals. They are then administered. Whereas the Serum Institute of India, in the case of Covishield, which accounts for 90% of all vaccinations in India, said it's entirely safe. Why don't you allow this to be available in the market? Now, Bharat Biotech with Covaxin has done the same thing. They have applied to the government and said, look, can we please have regular market authorization? Can this be available, for example, in pharmacies? But it's not going to be over the counter. It's going to be through a prescription.
Right.
So the government, the Subject Expert Committee, has said that, all right, fine, this is okay, and that these will be available at clinics and hospitals, but then, the Covin registration process has to happen.
Right.
So if a doctor says you can go ahead and get it, you can get the medication, but you will need it'll have to be registered as usual on Covin. But this is absolutely fantastic news because it means that you would be able to get that booster shot. But there is one key question over here which is unanswered. What is the interval of the dosage? Is it going to be 9 months, as is presently the case, after the second dose, which is being administered to senior citizens with comorbidities? Or is it going to come down to 6 months, which is what a lot of people suggest that it should? Why? Because around the world, 6 months is the usual interval because the antibody count actually decreases by that time. So that's something we don't know about.
Right.
But assuming that this market authorization means the easy availability of this vaccine, then it can be bought up by hospitals, it should be available in pharmacies, and people who need a booster dose can actually get it. So that's absolutely fantastic news. Finally, Ankita, it needs to be said, this is coming at a stage when Omicron is beginning to wane in our big cities, which is at least in Mumbai and in Delhi, which is great news. What would have happened had this been available several weeks back? How many people could actually have gained that additional protection that they need?
So, Vishnu, help me understand this. You're
Sure.
you're suggesting that this means that, people of all age groups effectively
Correct.
could get booster doses. We don't know what interval that would be between the second dose and the third dose. But explain how this would work. Right now, it seems to suggest, the information seems to suggest that this would be only hospitals and clinics attached to hospitals which have Covin authorization already.
Yeah, that's the source so far. So this basically means that this is cleared for market use. So hospitals presumably and clinics presumably would be allowed to, buy these from stockists of the Serum Institute of India and Bharat Biotech. You go there as you would for your normal vaccine dose, but all adults should potentially be given this particular, a vaccine, a booster dose is the assumption at this juncture. And which individuals? All adults above the age of 18. Children's vaccination has started in a certain age group, but they're not eligible for boosters right now. So it's all adults. Remember, presently a booster dose is being given to those above 60 with comorbidities and frontline workers and healthcare workers and election commission officials, among others, because of the elections, but not to all adults. And there's been a demand that, look, you need to boost, all adults in this country. That the government said that cannot happen because only emergency use authorization has taken place, and therefore the priority is first to vaccinate those individuals, such as healthcare workers, etc., etc. So several weeks back, the Serum Institute of India, and then after that, I believe Bharat Biotech as well, approached the government and said, look, our vaccines are very well tolerated. Can you please open this up for regular market authorization? In other words, this will be stocked, and it now, we are told, will be stocked, perhaps not at pharmacies, which I indicated earlier, but certainly at clinics and hospitals.
Right. Vishnu, at this point,
stock over there,
yes,
you go and get your shot, which will be registered on COVID, presumably as a booster dose.
Vishnu, at this point, is there any information at all about whether, we could be looking at possible mixing of vaccines also?
That's a really good question, Ankita, and, that's what a lot of people had wanted. But at this juncture, the government of India's official policy is, no, we will go with a third dose of the same vaccine. This is despite the fact that both Covaxin and Covishield, that there are two separate vaccines available in this country, have been given emergency use authorization. But they have not been cleared in a mix and match situation. Whereas Covishield and Covaxin are available as vaccines for those above 60, etc., etc. So if you've had two doses of Covaxin, then you are eligible for a third one if you are above 60 with comorbidities. So the policy of the government is that the third vaccine should be the same, and therefore, at this juncture, we are not talking about Corbevax or Covovax. We are talking only about Covishield and Covaxin, Ankita.
Vishnu, I suppose the other question that comes to mind at this point is about the availability of vaccines and sort of regular supplies. Clearly, that's also going to be key going ahead.
Well, I can tell you, based on our source, what we've learned from our sources, that 300 million doses of Covishield are presently available in the country, stocked with the Serum Institute of India, which can be spread across the country in days. They've got both the Serum Institute of India and Bharat Biotech have got a very fast and well-lubricated distribution process. So the vaccine will be available as far as SII is concerned very fast.